Are you going to stay awake for Carolyn's presentation? Everyone said they ate too much, which is not a bad thing. I'm going to do a few announcements, and Bunny's got a couple, and she'll introduce our speaker. Everybody always wants to know when public health is coming. They're back on December 7th, so if you didn't get flu or COVID shots, here it is. Please do note about the insurance. They're limited on what insurances they're billing right now, so just note that. And they'll be in the Rutledge room on that Thursday. Our holiday breakfast is coming up on Thursday, December 21st. You have these on your table. Please feel free to take one home. If you want to come, just please make a reservation with us by Friday, December 15th. If you've never gone to this before, it's a great event. The kids do the whole breakfast and serve you. It's a fantastic intergenerational event. So note that date. Little reminder, if you don't have one of these, we recommend you get one. We hope you never have to use it if the rescue squad comes to your house. But this allows them to have some real basic information if you can't communicate or if there's no one there to communicate for you. So very simple, front and back. And we recommend you put these on the fridge. And also up at the top on the left-hand side is the new after hours nursing advice number. Please note that it's different than the one on your phone book, but will be updated in the new phone book which comes out next year. So those are here and here, and there's extra if you want to take some. Newsletters if you're interested in what's going on with the senior meal program. And we actually do have the magnets for the nurse advice if you don't need the full card, you can grab a magnet and throw it on your fridge. I think that's what I got. I think that's it. So everything up here, please help yourself. We have a bunch of these sitting up here. Please help yourself. They're clips, they're magnets. We have pill organizers. We have some med boxes that you can secure your meds in. We have more than that. We just put one out. So if you're interested in any of that, help yourself or ask us for one of the med boxes. Here you go. Yes.
The last time public health was up here, they limited the number of insurances to one. And that's not right.
Well, as I explained that to you, that had to do with their contracts that their finance department.
They need to get different contracts.
Well, they were going to take that feedback back to finance. I don't know where that's at. That's why I'm telling you, please read that very carefully and call them to schedule if you're unclear, and they'll go over it with you on the phone.
If you have Medicare, you're covered.
No, you're not.
Not necessarily.
No, you're not.
Not all of them. If you have Medicare and no supplement, you're covered. But your supplement is very specific because they only have certain contracts. And what we think happened is during COVID, they kind of let those lapse because all the COVID shots were coming from the government and they were free. We're past that now. That ended in May. So that's why this came up. So hopefully they'll get their act together. We'll check on that. Here's Bunny.
First of all, thank you all for coming today. And it's nice to see familiar faces and some new faces. And for the next month, as Christine said, it will be at the school, the breakfast at the school, but then we'll be back here in January. It's tentatively in the air right now. We're looking for probably a bingo kind of fun one, and you would bring a white elephant gift, and that way we don't need a license. And I was thinking of, you know how you sometimes go to a party and you play a game and you get a gift. Then the next person who wins gets to pick either a gift from the table or to pick any gift that's been handed out already. So I thought we'd do that, and hopefully there won't be any brawls, but they don't have it. But so that's what's in the works right now. The other thing is we are having another coffee, cookies, and conversation. And that is going to be on a different day. It's going to be on Tuesday, the 28th of November. That's right after Thanksgiving. We're going to have treats, coffee, tea, water. We'll have a whole plethora of games that you can play. There'll be room for tables just to sit and have a conversation. And our very own Roxanne will do another trivia, and she will be baking another bread that will be the prize for the trivia. The time is 1 to 3. Be aware that you can come whenever you want to come, and you can leave whenever you want to come. You don't have to be there, at 1 o'clock sharp and think, oh my goodness, what am I gonna do till 3 o'clock? You can stop in, have some treats, maybe play a game. At the last meeting, we had people playing with the marbles, and we had another table of people just having conversation. We're hoping that this grows as a social place that you can go, first of all, for free coffee and treats, and in the daylight, because some of us are starting to not be too comfortable driving at night. And it's just, anyway, you gotta try it. Oh, the other thing is, if you come, bring a friend, please. Okay? Or an enemy, but bring somebody with you. Okay? All right. Okay, so having said all that, I would like to present our presenter for today is our very own Carolyn Reiter, our eye doctor here on the island, and she's much more, but for this presentation, she's our eye doctor. So, here we go.
Thank you for having me. Do I need a microphone? It'd be beneficial for the recording. Oh, so I'll keep the microphone. So thank you for having me. It's great to speak about eye care, and it is Diabetes Awareness Month. For those of you who I have not met, but I think I've met pretty much everybody here, but for those of you who I have not had the pleasure of meeting, I moved to the island in 2017. We've been coming to the island, whole family, for probably close to 20 years. We bought land right away, and then what happened in 2007, right? The economy dropped. So we just sat on our land for a while, and then before our kids went into college, my husband said, well, we better build our house before the college bills roll around, because otherwise then we'll never build our house. So, so that was a good move, because the Young brothers built our house. I think it was like the last one from beginning to end that they built, and it was finished in 2015. And during that whole process, it was probably about a 1.5 year process, everybody who I was running in contact with, coming in contact with, encouraged me to at least open a practice part-time. I'm originally from Chicago, and then my married life is Silverboat, Chicago, and so after 25 years of practice, so life comes kind of, not full circle, but time to do something else. So after 25 years of practice and building a house, as a family decision, I left my practice in Illinois and moved up here full time and opened the eye care clinic in the community center. And it's been 6.5 years, and it's one of the best decisions I've ever made. So the community has been really supportive, and I believe it's been 6.5 years. So so thank you for having me. Really, really appreciate it. So November is Diabetic Awareness Month, and it's not just U.S., it's global. The U.S. Kind of categorizes November as the whole month of diabetes awareness, but the global day was 2 days ago on the 14th. And just to give you statistics, since it's awareness, it's always good to hear these numbers again, just to kind of, so it hits home. But the International Diabetic Federation, there's 537 million people living with diabetes globally. And when I'm talking diabetes, I'm talking about type 2 diabetes. Type 1 is just under 9 million globally. So for this conversation, we're going to be concentrating on type 2 diabetes. So in the US, right now, it's 37 million, which is about 11% of our population. And then pre-diabetes, I'm going to be just a couple buzzwords right now, because you've probably heard of these words, but they're fairly new in the whole diabetes world. But there's 88 million in the US with pre-diabetes. And so what is that, or you may have heard that. It's basically having an A1C or blood sugar hovering around that 5.5 to blood sugar of 90. And what's concerning these days is that in that prediabetes, it's not so much just adults. there are a lot of teenagers in that pre-diabetic category. So that's what's driving up the numbers to around that 100 million in the US. So concerning percentage-wise, we're talking almost 25% of our population. So you think, okay, well, what are we doing? Historically, we would always follow, let's say baby boomers, and that kind of health trend. What's the incidence of hypertension? What's the incidence of cholesterol and diabetes? And we always kind of followed, just the baby boomers, but now we're following the kids as well, which is really, really concerning for a lot of people. And what are we doing? What are we doing in our society? And so what we did was, you have to think about what we did in the US. In the 40s, our food industry changed after World War II, right? What was happening? The processed foods were going up, the food economy was changing, fast food was coming in. There was a lot of things, going on. And then the birth of the baby boomers. So we had an increase in population. So in mid-40s to mid-60s, that baby boomer population, we were thinking, well, how are we feeding ourselves? And then the baby boomers had kids, right? So, and then what else happened? We had the computers. So we're not getting outside anymore. So that is, you can think that as that cycle of just social events that may have been contributing to, this kind of epidemic that we're having now. As far as the U.S. globally, you think, okay, where are we in the world? Are we number one? A lot of people would think yes, we're number one, but we're actually not. We're around, on the list of countries, number 59. So who is number one as far as the incidences? China and Pakistan, there's French Polynesian country, Kuwait. There's a lot of studies out there that South Asia and then the Middle East may be resistant to insulin. A lot of studies going on with that, right now. But where are in the states, what states are the most prevalent in diabetes? It's hovering in the southern states. So that could be Mississippi, West Virginia, Louisiana, Texas, South Carolina, Alabama, Georgia. All of the southern states are running around that 13 to 16%, so they're a little above that national average. And then you were maybe wondering where Wisconsin lays. We're right underneath the national average. So national average is around 11%. Wisconsin is at 8.8%. So we're doing a little bit better than the national average. So then with diabetes, it's the increased cardiovascular disease, stroke, end-stage kidney disease, and leading cause of blindness, which I'll get to in a little bit. So definitely an issue, and just to be aware that it is a huge, huge concern. Factors. There's a lot of factors, and it will always come down to lifestyle. Nutrition and lifestyle, obesity and activity. There's a lot of diabetic cases. The new diabetic cases, newly diagnosed, 89% are overweight, and 38% admit to leading a sedentary lifestyle. And it does go back to what did our food industry do in the 40s, and what did we brought computers in our homes, right? So the kids aren't getting outside anymore. They're sitting in front of a computer for their schooling and for their social. And so that combination is definitely contributing to, to the diabetic epidemic. As far as the foods go, I think everybody knows this, but just as a refresher, the inflammatory component of our modern American diet, processed foods, refined carbs, keeping it simple, anything white is going to be inflammatory. high fat, saturated fat, both animal and dairy, and then also the sugary foods. So those are the obvious things, that we have been adopting as far as the American diet goes. And, just not to get too technical as far as biology, but, when we eat a carbohydrate, what does our body do? It converts it to sugar, and then, which is the glucose, blood glucose, right? And then when that happens, the pancreas turns on the insulin. And the insulin is going to absorb that sugar and either store it, or we're gonna use it as energy, or store it for a later time, right? So that's the process of blood glucose. And so if there's too much, keep it easy, right? If there's too much going in, it's that pancreas is not gonna keep up. So what's gonna happen, another buzzword right now is insulin resistance. It's just that pancreas is way overloaded and cannot keep up with absorbing that, or secreting the insulin. So then your blood glucose will spike. And if it's spiking for months and years and you don't even know it, that's where the underlying damage is going to be caused. So that's kind of what's going on there. You'll see or hear about insulin resistance. And I think insulin resistance is together with that pre-diabetes, because if you go to the doctor and if you're told, you have pre-diabetes, you probably have, that insulin resistance. Your pancreas is on overload and just can't keep up. So what can we do? Let me back up. If the pre-diabetes, if nothing is done, if someone is diagnosed with pre-diabetes or been told that your A1C is hovering around 5.5 or your fasting blood sugar is 90, and if you don't do anything, 70% of the people within 5 years will be diagnosed with diabetes if nothing is done, meaning a lifestyle change. So my personal opinion is, think of it as like kind of your wake-up call, and that person could be 18 years old these days, right? 16 years old, 16-year-olds are being told that they have an A1C of 5.5, and so they need to do something. Everybody needs to do something. So what can we do? And I think everybody knows this. The whole fruits, the vegetables, the nuts, the beans, the whole grains, the lean meat, the fish, everybody knows this, right? We just need to do it. Unsaturated fat, olive oil, the avocados, the Mediterranean diet. It sounds a little cliche, but everybody's like, gosh, if we could live in Greece and eat the Mediterranean diet, we would cure our diabetes. But this is off topic. This came, not too much off topic, but it has to do with macular degeneration. And it's a pretty new study, 2021, and it's a spin-off to the AREDS 2. If anybody's taking eye vitamins, that AREDS 2 term is very familiar to. And it's an eye vitamin. The AREDS 2 formula is an eye vitamin for macular degeneration. And very, very well studied, a lot of people in the study, and they kept a lot of people in the study, but in 2021 they had a 10-year, kind of follow-up, and they looked at the Mediterranean diet, and Mediterranean diet, which is, again, the fish, the oils, the nuts, the seeds, very little red meat, eliminated the red meat altogether, very, very limited. It stopped moderate to severe macular degeneration by 30%. So that was just brought out in 2021, which is huge. 14,000 eyes in a course of 10 years. So it's a good, reliable study to, to kind of think about, So just a matter of changing your diet and introducing all those good minerals and vitamins and healthy fats. If you could reduce something or reverse something by 30%, that's great. That's really saying something. So just a little thoughts on that. Also, the insulin resistance to help probiotics has been known known to help with insulin resistance. Magnesium levels. Magnesium levels is, I wouldn't say it's fairly new. It's been out for a little while, but you know, if you go to your doctor, they'll say that you're deficient. Everybody is deficient in magnesium. So you know, by taking that, you could increase your or decrease your resistance to insulin. Also, the stress. Stress will increase cortisol. Cortisol will increase the insulin resistance, you know, as well. So just some of the things that we could do to reduce that. Everybody is told exercise, right? So eat right, exercise. And I always think, you know, what's the detail on exercise? Kind of makes sense. Well, why wouldn't you exercise? You feel better, your joints feel better. As far as the science of exercising, when it comes to insulin resistance, it increases nitric oxide. And again, that's another buzzword, nitric oxide. If you go into the holistic in nutrition and holistic medicine and functional medicine world, you'll hear about nitric oxide. And what is that? It's produced in the pancreas, and it contributes to the secretion of insulin. So you can see that connection. If you increase, nitric oxide will increase permeability. It's a vasodilator. And so it will help with the uptake of insulin. So help your body produce its own insulin. Nitric oxide in my world, in the eye world, about 2 years ago, there's a new glaucoma medicine. It's a medicine that's been out for years and years, but they just added nitric oxide to it. And so it was approved 2 years ago, and it's a powerhouse glaucoma drug. And so the science behind that is the nitric oxide absorbs into one of the structures of the eye called trabecular meshwork, and it increases the permeability, and the patients get like 20 to 30% further lowering in their eye pressure if they have glaucoma. So it's a wonderful, wonderful medication, but it has nitric oxide in it. And ever since that medication came out, I didn't pay attention to nitric oxide in the body, but it's in the nutrition world, that is it's kind of a new buzzword. So just, you know, if you hear about it, if you read about it, just, you know, take an extra time and read about it. It's really interesting. The gut microbiome. That's another buzzword too, right? Who talked about the gut? Who cared about the gut? Like 15 years ago, even 20 years ago. But the dysbiosis, or the imbalance of bacteria in the gut, is a risk factor for type 2 diabetes. We're getting into, with the gut microbiome, it's really tough because you know, you go to your general doctor, your conventionally trained doctor, for a lot of nutrition advice, and do you ever feel you get the full answers you're looking for? It's no fault of them, but if you're relying on your regular primary care physician or your endocrinologist for nutrition advice about your guts, there is the nutrition training in the US or even globally is really inadequate. And it's just a fact. It's just not part of the world of med school and in their continuing education that they need to do. So I think you just have to self-advocate for yourself. That's where nutritionists come in. Hopefully, you know, YCHIP may even start having a nutritionist come up, or if we could find a nutritionist on the island to come in and just make you aware of like what your substitutions are and what you could do and make it fun. You know, that would be really great as well. But definitely the microbiome and having guts, a variety of bacteria bacteria in your system helps with the process of glucose. And a lot of diets, you could drive yourself crazy trying to think of all these diets, but some points are really easy to remember for me. And I read an article in one of my plant-based cookbooks, and they're like, for good gut variety, try to do 30 plants per day. Now that sounds like a lot, but plants meaning like herbs count. Okay, so especially with diabetes, hypertension, you're trying to reduce your salt, your sodium intake, and you're trying to make your food tasty. So if you're going to be putting in oregano, basil, fennel, so that, your herbs could add up to like 6, in one meal. Also somebody, I was reading another article, and again, the whole confusion of different diets, and again, you could drive yourself crazy with trying to remember this stuff. But really, a good thing to remember is how many times are you eating leaves per day? And if the ant leaves and salad and spinach, so it just makes you think. If you're never eating leaves ever, that's something to consider. But if you're eating leaves at least, once a day, you're probably on a pretty good track. So just like little certain pearls to think about, because all these diets that come out that sound so cliche and trendy, sometimes they're not, good for you as well. So just a couple things to think about. Also, in epigenetics, I don't know if anyone's familiar with epigenetics. I think it's a fascinating world, but the NIH, National Institute of Health, came out with gene expression through nutrition. A lot of that sounds so, how can that be? So it doesn't affect your genes, what you're carrying, but how your genes are expressed. Meaning, how could, and everybody probably has this discussion or has this in their family. Oh, my parents, both parents had, X, Y, Z, but I'm okay. And a lot of people will say, well, it's a lifestyle thing. Well, my parents, at the time, everybody smoked. So we ate fatty foods and we smoked, but that's not what we're doing now. So what's that percentage? Is 30-70. So 30% are your genes, 70% is in your control, which is pretty powerful because you could ward off a lot of health issues with your lifestyle, and a lot of that is your diet. So there's a lot of resources out there, especially if you feel like you need to self-advocate. A lot of my diet nutrition is self-taught. There's the American Nutrition Society. I personally belong to the Optical Wellness Nutrition Society. There's a lot out there you could research in as far as the American Diabetic Association, what the general guidelines are. So there's a lot out there on nutrition. Basically, it's really kind of going more toward kind of plant-based. Not that you have to be a vegetarian, but at least to introduce a lot of that plant-based items, into your daily routine. That will, decrease the amount of diabetes, or the incidence of diabetes. Okay, so eyes. Let's talk about the eyes. So that's the background about diabetes. Way too much, right? Okay, so unfortunately, ocular complications. There's a lot of new things coming out. Unfortunately, about 27% of people with diabetes will have some sort of diabetic retinopathy. And what is diabetic retinopathy? It's bleeding in the retina. It's ischemia or inflammation in the retina. Glaucoma also. anybody with diabetes is at more risk of glaucoma and cataracts. It's also diabetic macular edema. On the more severe end, could be retinal detachment. So the last two, the diabetic macular edema and the retinal detachment, are obviously the most sight-threatening. Of the 27%, 5% will have diabetic macular edema and or retinal detachment. So it's a huge concern that 5% in the US, we're talking 2 million then. So 2 million people every year in this country is really, their sight is threatened with type 2 diabetes. So the current recommendation is annual eye exams. The diagnostic testing is unbelievable in the last 25 years. It will pick up early, very early signs of potential sight-threatening issues. Your vision can be really not too much affected, but there's the smoldering fire going on. So I would encourage you, whoever you see for eye care, that they do these tests, and they will. I mean, most people do. You have definitely, you don't want to wait until vision is 2200, 2400. You do want to address it pretty fast. The treatment for diabetic retinopathy is usually laser, or it's also called, there's injectable medication, so it's really injectable medications first. Sounds horrible, but these retina guys and ladies, doctors, they do the injectable medications obviously in the right spot. So they're very, very effective. They've come a long way in the last 15 years, and they've done wonders for diabetic macular edema. Retinal detachment, you're into surgery, or if it's partial detachment, you're into laser. But the anti-VEGF, they're called, and if you ever know anyone or talk to anybody who has to go down to Green Bay, it's pretty much Green Bay, who have to have injections, they're having an anti-VEGF. What is VEGF? It's a nomogram for vascular endothelial growth factor, and that encourages excessive blood vessel growth. So it's basically blood vessel growth that should not be there. Some people will, I equate it to the heart, because a lot of people will forget that how everybody, if anybody has a heart attack, they'll grow extra vessels as a protective measure. It's the same concept in the retina. So if the retina is starving for oxygen, extra blood vessels will be growing in an area that should not be there. And what happens is sometimes they'll leak. And so that's how the vision is affected. So that's where these injectable medications come into play. They basically stop the leakage right away, and they prevent further vessels from growing. So one of them actually was a chemotherapy drug that is now used for the injection to prevent or stop diabetic retinopathy. Some exciting things as far as, and this is another one too. This is going to be, and I'm saying this because it's in the advertisements or advertisements on television with all the drug commercials that we have. There's a new anti-VEGF, it's called Vabysmo. It was just approved last year. The benefit of this is that if anybody is familiar with injections or has a friend who has to go down to Green Bay for injections, it's a monthly trip, and a monthly trip sometimes for 2 years. And then the whole goal is to do the treatment and try to extend it out as much as possible. And so this particular drug is out to 16 weeks, which is a game changer for a lot of people. Obviously new with insurances, talk about insurance, right? that would probably, anything new is probably not gonna be fully covered unless they do some sort of, emergency coverage or something like that. So just to let you know, they are trying to, these medications are nothing new. They've been out for a long time, and so obviously going from 4 weeks to 16 weeks is significant, especially anywhere in the country that's rural, and we're traveling 2 to 3 hours to the closest, retinal specialist. So that's kind of the, as far as the eye care goes. The eye is very fragile, and it's not so much nutrition, in the advertising, nutrition in the eye. And I say there's nothing, not nothing, but the eye is connected to the body, right? And so anything you can do nutritionally and lifestyle-wise to the body is going to benefit the eyes. Also brain health, going back to the microbiome and brain health, that's going to be a lot of studies right now. And if it affects the brain, it affects the eyes. The eyes are developmentally an pocketing of the brain. So I always tell people that the optic nerve is brain tissue. So people know, it's like, okay, I had a stroke, it was in the brain, I had an emboli in the brain. But it's the retina and the optic nerve is pretty much, cohesive with the brain and the heart as well. So, we're all one system. As far as what else we could do too, the supplements, a lot of people are on supplements, and I just want to touch on a few things. Again, not so much diabetes, there's a little bit of an overlap, but supplements. I like supplements. Granted, food is always best. But just kind of be careful, with supplements. Just know what you're taking. As far as brands go, and I'm not going to go into any certain brand, but there's synthetic brand, there's vitamins and supplements that are synthetic versus natural. You always want to go natural. And how do you know that? You can easily look that up. I looked up a couple just last week, and is it a real plant-based product versus synthetic? I will tell you most vitamins in the US are synthetic. And if your vitamin supplement is manufactured by a pharmaceutical company, it's probably synthetic. Now, is that a bad thing? You're probably not getting, if you're gonna take something, make it work. And a lot of these won't get absorbed, and you're kind of spending money on nothing. So just look it up and see, make a choice for yourself, if you think it's a quality product. If you don't think it's a quality product, then either switch or don't take anything and rely on your food. Because again, food is always best. There's one thing that I want to bring up as far as supplements go, and again, it's kind of it's a little sidetrack, but because macular degeneration is so overlapped with diabetes, and this is the latest, I want to bring up kind of latest studies too, since I have a captive audience here. Be careful with zinc. I'm on this warpath right now with zinc, because what did we do? So say, for example, you want a supplement, you're taking your multivitamin, and you turn that bottle around, and you see that you're taking 15 milligrams of zinc, right? Which is probably pretty normal. And then you have early to moderate macular degeneration, and your eye care provider put you on an eye vitamin, right? And this AREDS 2. This AREDS 2, everybody does, Preservision AREDS 2, it's made by Bausch & Lomb. And the reason why they made that recommendation is that's the vitamin they used in the study. So of course, why go off the beaten track? You're gonna recommend, the Preservision AREDS 2. I don't know why Bausch & Lomb did not decrease the zinc, because from AREDS 1 to AREDS 2, there were 2 studies, very well studied. And the difference in formula is they got rid of the beta-carotene because we were recommending beta, and this is a long time ago. Beta-carotene in current smokers, there was an 11% chance of lung cancer. So oh, okay, let's get rid of the beta carotene because who are we recommending? Who has macular degeneration 4 times risk is smokers, right? So you can see the conundrum right there. And so so we got rid of the beta carotene, we added the lutein and zeaxanthin, which is the carotenoids, right, to help the macular pigment, which was a good change. And then they looked at the zinc, and the original formula had 80 milligrams of zinc, and they said, down to 25 milligrams, you still get the benefit. But, in the second formula, AREDS 2, they kept it 80 milligrams. So if you know anybody, or if you yourself are taking Preservision AREDS 2, there's 80 milligrams in that product. And then what do we do during COVID? It's vitamin D, vitamin C, and zinc, right? It's that little kind of COVID cocktail, I called it. And everybody started taking that. So just be cognizant, and then we didn't go see doctors. So anybody who, let's say, moderate, macular degeneration, severe macular degeneration, they kind of like said, okay, I must be taking this because I don't want to get COVID. Nobody wants to get COVID. And we saw moderate macular degeneration just skyrocket, and geographic atrophy, the severe form of macular degeneration, really just skyrocket. And if you're taking over 100 milligrams of zinc daily, 15%, if you don't have a genetic test, and I'll get to that in a second, if you don't have a genetic test to see if you have the genotype that makes you at risk, zinc, it's been proven, zinc will cause, or AREDS 2, zinc will cause your macular degeneration to get worse. So, any type of severe macular degeneration, meaning end stage, or, and this is just in the last 2 years too, I've been taking people off their AREDS 2. That AREDS 2 formula is supposed to stop people from going into severe macular degeneration. There's no evidence at all that it will stop. Once you have severe macular degeneration, you might as well just stop taking it, because there's no help in it. So just be, my point is, just be aware, and it doesn't need to just be, I bring zinc because in my world, that's a pretty eye-opening, example. But just be aware of what you're taking. The biggest mistake of supplements is, it's not a medicine, so it doesn't do anything. And, your doctor probably has already told you, don't take this, it'll react with some medicines. So I would say my best advice is for supplements is, be confident in the brand, and make sure it's not interacting with any other medications that you're taking. Let's see. Okay. Any questions before I go on to just 2 public service announcements that I want to make to the community?
Would a pharmacist be the person to ask rather than a doctor about interaction with medications?
Yeah, they should. Yeah, absolutely.
Because they would have a better handle on it, I think.
Yeah, I would think. And as far as supplements with medicines, yeah, that's a good resource. It's a very, very good resource. Yeah. And as far as resources go, I just brought a couple books that I personally, I'm not going to advocate to any of them, but if you're thinking making it fun, plant-based, if you want to kind of go into the holistic or functional medicine, and again, it's a little frustrating with the medical community. Again, no fault to them, but their education of nutrition. So we have to look elsewhere. So it's either learn it on your own, or a nutritionist, or a functional medicine doctor. I personally like I was trained, conventionally, but now I'm doing both. I like my whole life. I've tried to see both ends of the argument. So that appeals to me. And so I have a book here that it's Will Bilsowitz. I don't know if anybody has red, the fiber fueled, and again, it's plant-based, but you know, you don't have to go all the way plant-based, you just introduce some of his ideas. But he's a conventionally trained GI doctor out of Northwestern in Chicago, and he just kind of got fed up with like all functional medicine doctors who are conventionally trained. And he, you know, kind of went, he needed to take charge of his own health, you know, and he was kind of tired of, you know, this pill and that pill. So he just has a theory, you know, about plant-based. And then also, which is more fun and intriguing, if anybody is familiar with blue zones. And blue zones, there's an author, it's Dan Bertner, and he has discovered certain communities in the world who have an unusually high amount of centurions, people living over 100. And it's not just living, it's like truly living. Their mind, their body, and so it's like, what is it about these communities that gives them this wealth of life? So it's very interesting. It's one of them is Loma Linda, California. It's the only city, you know, in the U.S. So he even touches on Seventh-day Adventists and the community sense of community. It made me think when I was reading this. I'm also a Lions member, and some of you may know I planned a fair, you know, in August. And one of my jobs to call anybody over 90, you know, for the float, you know, in the parade. And I'll tell you, we had 8, you know, and it just was so impressive. Like, wow, 8 people over 90, you know, and I have a picture of the ladies, like they were having such a hoot, you know, hoot at the time. So it just made me think, you know, the sense of community and the meal time, so it's not just diet, it's like a whole lifestyle thing. So if you're a Netflix fan, there's a documentary, Living to 100, and it's about the blue zones. The very, very first blue zone community that he kind of labeled blue zone is Sardinia, Italy, which I'll be visiting in May. I find it very intriguing, and my goal is to just walk the streets and talk with Italian. They speak Catalan too, so I have to bring my daughter with me so she could kind of muddle through the Catalan. But, you know, but what is it about this community that they could live well, you know, into their hundreds? So I just find it very intriguing. But that's kind of more fun stuff. I have the cookbook here. My daughter bought, because I just kind of jumped on that bandwagon, so she bought me the cookbook. Okay, so anything else before, yeah, Carol?
I'm sorry, you were talking about diet before and spikes and whatever.
Mm-hmm.
And when I was diagnosed when the dinosaurs were still around, I went to every diabetes class I could get, and I started reading labels. And it said no sugar, and then it had fructose. And it said no sugar added, and it had dextrose. And it said, you know, the same thing. And I went and said, can I still eat this? And they said, no. Anything with OSE is sugar, and it all does the same thing. But is it still what you're saying? Because I went into lots of fruit, and my A1C went, you know, and I thought I was being so great. Sugar is sugar is sugar, and it's all got to add up, or is that modified? Is there any changes to that?
So if you have diabetes, you have to be careful with your fruits. And so, yes, you are right. Anything OSE is a sugar. Whole sugar, meaning fruit, fresh fruit, is best. And the reason why is because you have the fiber along with that. So say the oranges we had today, yes, you're gonna have fructose, but you're gonna, if you had some of the rind, it's the fiber offsets it. So you're not gonna have that spike as much versus, let's say, a glass of juice, right? So, so this, it's not, you asked about modified, it's not modified, it still is the case. And then you really want to like low glycemic index, and that's another kind of, I'm gonna say buzzword, it's been out for a while, But that's easy to look up. If, let's say, if you're not diabetic and you just want to, watch your sugar, see what fruits are best. You want to see what has the lowest glycemic index. And in fruit, I could say that blueberries is there, blackberries is there. A lot of the berries are okay. Bananas, because we like the potassium, especially if they're ripe, they're kind of off the charts. So the banana, you want to do maybe just one or two. But if you're already diabetic, you want to be really careful with that. So there is no change in that, but you want to pick the lowest glycemic index. And that's true with any food. All the white pastas, the rice, it's all going to spike your sugar.
I also was told that aspartame and all those fake sugars will actually bring your system act like sugar anyway. So what's the point? I mean, I do it anyhow because I've done it. But I mean, is that raising it the same? I never got a really good answer to that.
It will. It'll raise your sugar, and again, anything synthetic, you kind of want to stay away from, right? So, and you have to pick your battles and the least of evils if you can't change. If you really need sweet, maple syrup and honey. I know it has a glycemic index, but it's a lot better than a spoon of white sugar. So, and whole fruit is going to be better. So if you really need sweet, can you mash up, like instead of doing a prepared jelly that I haven't made myself, I'll do a berry, mash it up and put it on my toast. So, at least you're getting the fiber along with the fruit. That brings up a good thing with taste buds too, with salt. If you're a fan of Michael Pollan, Omnivore's Dilemma, that's a really good kind of fun anecdotal book. In the beginning, it goes through the whole food industry from the 40s and 50s and what we did as a country and advertisements and things like that. But he said your taste buds will change. So you just kind of have to muddle through it. Salt, your taste buds will change with salt in a month. If you could in a mindset, okay, I'm gonna give myself this 30 days for the rest of my, and you just don't want it anymore. Fat and sugar take a little bit longer, but if you can really muster up that courage just to not do it, you just don't want it anymore.
I've not reached that point. Salt, yes.
Yeah, salt is easy because, again, the herbs, if you're doing, again, you're gonna remember the 30 plants per day, and your herbs are part of that. Just load it up with all your good oregano and garlic and everything, because garlic counts. So salt is, I think, kind of the easy one. The sugar and the fats,
Fat's easy, got rid of that, no, but
Yeah.
sugar is still hanging in there.
Anything else? A couple service announcements, and if there's any questions, please, stop me. So I touched on severe macular degeneration, because I know in our community, and you probably have been told there's a lot of, you must, in the conversations, yes, I do have to go down to Green Bay for injections, or I've been told there is nothing. Severe dry macular degeneration or geographic atrophy. I bring this up because I've seen it on the television. So why are they all of a sudden using the word geographic atrophy? Because just in August, there was one earlier in the year, but just in August, and I have yet to call the retinal specialist in Green Bay. So stop me in the streets in about a month and I'll have an answer for you. There's treatment. So if you were told that there's nothing more to do with your vision, and it's very sad, people are going blind from geographic atrophy, there's treatment. The class that I just attended, obviously the big teaching institutions, they're on board with it. A lot of other retinal specialists around the country, they're taking let's sit back and see what adverse side effects there are, because FDA approved versus clinically, it's different. But that's encouraging that there is treatment for geographic atrophy. The artificial tear recall, who is like crazy with the artificial tear recall, right? There's blindness and death. Did you guys hear about this? So I brought the latest list. If you are concerned about what's in your medicine cabinet because of an artificial tear that is causing death or blindness, you could look at my list here. It's basically generics. They're the only thing, I do recognize a lot of them, but I would just bring up because everybody knows Equate, right, from Walmart. If you have Walmart Equate artificial tear, I would just pitch it. They have found, it's a company from New York, but I don't know where the manufacturing plant is. The investigators found Pseudomonas in the manufacturing plant. So, Pseudomonas ulcers, the worst. I've had one in my 30-year career back in Illinois. You do not want Pseudomonas ulcers. That's why I tell my patients here, do not swim, lake, pool with your contact lenses. It's awful. But if it gets in your system, in your sinuses, it's more systemic wide. So if you want to look at the list, I do have it. Basically, it's generics. There's no name brand artificial tears. And another thing I want to bring up is I'm also the Lions member. I'm a Lions member. And I joined the Lions Club when I first moved here because the Lions Club is based on vision and hearing, so it almost seems silly not to join. It's a good group of guys. Up until last year, I was the only girl, so they tolerate me. And then there's another girl who joined. So women are welcome. So spread the word. Lions International president is female, so why not, right? But I love it. It's a great group. We give a lot back to the community. This is going back to 2018. If a lot of you know or knew Ross Meter, and he was influential in us, meaning me, who represents my office, Nordor Island Eye Care. Ross at the time was representing the Lions Club, and then we got Christine Anderson involved with White Chip, and we started and we renamed it the Ross Meter Memorial Eyeglass Program. And we put his name to it because a lot of people were getting it confused with the donation. So everybody knows that donation. Oh, I'll donate my glasses to the Lions Club, maybe even a hearing aid, and eventually they do good work with it. This is not it. So I wanted to give Ross continue his memory. He was influential in starting this program, but it's an eyeglass program for any resident of Washington Island who needs eyeglasses, who are in need. So I work with their insurance, and if that's not possible, I just donate my time. And then also with the glasses, it's a brand new pair of glasses. A lot of people are like, oh, it's a kind of a borrowed, used pair. Between my supply and my lab in Green Bay, we get someone a pair of glasses who really, really would go without them if they cannot afford them. So I just want to let you know that program is out there. I would be the contact for the office. Jeff Heel would be the contact for the Lions, and Christine Anderson would be the contact for the White Chip. So if anybody has questions, if you know anyone, because I know word of mouth is key, right, in our small community. If you know anyone who really, really is in need of glasses or an eye exam, and we don't care about insurance, just have them get in contact with one of us, and it'll get done. And then privacy is always upheld, it's, because that's definitely a concern, so privacy is always upheld. So I just want to let you know that program is out there. I'm going to do a little blurb in the Observer still, but I think every so often it needs to get out there that program exists. So he was really helpful. He came to me, it wouldn't exist without him, so that's why I wanted to acknowledge him. Down in Racine, where he was from, they said they did that all the time, and it's been a great program. I think we just need to get the word out a little bit more. So I wanted to bring this to your attention, so in your casual conversations, you know, if it ever came up, just send them our way. Okay. I think I'm done. Any questions?
Comment. We all really need to realize that we have a very unusual eye doctor up here. Not everyone practices at that level. I'm incredibly impressed in what you've done here. I've been to a lot of them, and I'm impressed. Thank you. Also, just remember that diabetes, I look on it as a vascular disease. Because your heart, your liver, your kidneys, all those things that need blood can be affected by diabetes. And the less you got, the better you are, basically.
Thank you for having me.
A couple of things, don't forget the survey on your tables. And there was a lot of pasta left, so there are packages on the table there. So if you'd like to grab one or two to take home, please do. Okay? Okay, see you next time, and happy Thanksgiving.